Welcome back. We are taking a look at the well-being of mothers and babies, and to speak more on this topic and the nonprofit as well, we're joined by Thrive Wellness Collective founder and executive director Allison Tatari. Allison, thank you so much for joining us.
Thank you for having me.
So tell me a little bit about the Thrive Wellness Collective and what that is and why you decided to start it.
Thrive is a nonprofit. We're a 501c3. We subsidize the cost of maternal health care, maternal mental health care. So that would be midwifery service, doula services, and maternal mental health services.
And so tell me a little bit, because you are a licensed midwife, why did you feel like there was a need for this? And why did you decide that you wanted to kind of delve deeper into it?
Yeah, as a midwife, after attending births for several years, I founded a birth center in Pacific Beach. And that is where I saw, first of all, Medi-Cal and insurance did not really cover that, so it wasn't accessible to everyone. And we wanted this individualized, beautiful, much needed care to be accessible to everyone, no matter their financial status. So that was why I founded Thrive.
Yeah, and so tell me a little bit about what you guys do now, because you've been around for 4 years, and tell me about some of the work you're doing.
So at this point, we are funding births throughout San Diego County. So we provide subsidized care for home births, so midwifery care for home births, but also we provide subsidized midwifery home visits for women that are giving birth in hospital as well. We provide funding to subsidize doula care, postpartum and birth care. Mm-hmm. So the point is to help women that are wanting individualized care, they want to honor physiological birth process and try to have an unmedicated birth, that they have that individualized care that you can get from a midwife. And most insurances don't cover it, like I mentioned before. And we're also, it's not just home birth, we're reaching out to women in the hospital setting. 98% of people give birth in hospital. And that is where we're seeing the worst outcomes. America has the highest maternal mortality rate out of any developed country, and 98% of people are in the hospital, so we know that's where we need to go. So if a woman is discharged and coming home, she needs to have that care before that normal 6-week postpartum visit with her OB. So our goal is to get the midwives out there to work with them. We spot emotional and physical illnesses that we can prevent by this care. So being out there within 48 to 72 hours can really make a huge difference in the outcome.
Wow, and so you guys actually have a clinic and an event that's going on, just networking event on February 19th, correct?
Yeah, on February 19th, it's a birth worker appreciation networking event. It's gonna be at 6:30 in Pacific Beach at Cafe of Life. And we're sending invites out to OBs, nurses, midwives, doulas, acupuncturists, anyone that works with mothers. And it's worked really well. We had one a couple months ago. What we're doing is we're trying to bring the community together to create better outcomes, because it's not just one person's care. We know, I'm an expert in physiological birth, but I am not a mental health specialist. Mm-hmm. I'm not an acupuncturist. If it's high risk, I need an OB. So we want everyone to come together and collaborate so that we can be a really strong resource for the women in our community.
And now, if people want to find out more information about Thrive Wellness Collective, how can they do that?
They can visit our website, which is thrivewellnesscollective.org. Also, we have an Instagram, Thrive Wellness Collective _ and they can also reach out to me. I think you're going to list my phone number and my email, I think later, but they can reach out to me, Allison Tatari, through the website as well. My information is there. And then we'll have information about the upcoming events as well listed on our social media.
Okay, well, very fascinating and great resource for people as well. Thank you so much, Allison, for coming in.
No, thanks for having me. I appreciate it.
All right.